Cornwall Hospice Care is governed by a voluntary board of trustees. I'm Lesley Ross and I'm the current chair of the board. I've been involved with the hospice movement for now nearly 20 years. Prior to coming to Cornwall 12 years ago, I was heavily involved and worked for both a children's hospice and an adult hospice, and helped them with both their financing and fundraising activities. When I first moved to Cornwall, I approached the hospice and asked if I could help them in some ways, and ended up actually co-opted onto one of their subcommittees, and 2 years later was asked if I wished to become a board member, and that was nearly 9 years ago. The board comprises a balanced group of people who each bring different skills, different professional expertise, and as a group our role is to set the mission of the charity. We establish the aims and the values of Cornwall Hospice Care. It's also our role to appoint an executive team who are the people on the ground who will follow those aims, our strategies through. And obviously an important part of our role is to monitor that performance. When as a board we set our strategic objectives, we have a lot of things to balance, not least of which are limited resources, unreliable resources from year on year. So it is actually very difficult to plan. But overridingly, and this is what makes volunteering for the hospice so wonderful, is that the primary motivation is to deliver the excellence of care, end-of-life care for as many as we can in Cornwall, and support for those who are left behind. Within that, we have to look at our clinical staffing, the professionals who are delivering that care, all the volunteers who support both the care and the funding for that. And that is a big thing to meld together. We have commercial operations and clinical operations. And to get that message across is really very difficult. We're not just one thing. I've seen in my nearly 20 years within the movement a lot of changes, not just in the delivery of care. That has evolved. It's wonderful to see how a lot of it is now accepted practice, but expectation has changed. Expectations from people, and that is brilliant, but it's actually quite hard to meet that expectation. But the movement itself has changed. It used to be that it would keep itself to itself, and it wasn't something that it wanted to go out and talk about. It wasn't something people wanted to hear and to know about. And that has changed, and that has needed to change. And certainly for us as a charity, it is important that we do let people know there is a continual striving to meet the changing needs of people, and a striving to be innovative, to use our expertise and our professionalism in the best way. The future for us, I think, is about collaboration. There are too many people who fall between gaps in service delivery, and to collaborate, I think, is the way forward. To truly find out what people want for end-of-life care, and to be able to be part of a group of people who are able to deliver that. So in the future we need to be better at letting people know what we want to do, what our vision for the future is, and be able to bring primarily our patients with us, because that's what we're about, but all those who look after them, our staff, our volunteers, and all those wonderful supporters with us, so they understand what we're trying to do, and they can appreciate the whole effort that goes into it. I am Cornwall Hospice Care.